This is Diabetes by Trevor and Andrew.
Type 2 diabetes. How it works. The stomach down over here and the pancreas. Once the blue is the sugar, the green is the insulin. When the stomach converts food to glucose or sugar, the glucose enters the bloodstream. The pancreas produces sufficient insulin, but resistant to effective use. Glucose unable to enter cells effectively, so the glucose levels increase.
Alright, so there are two types of diabetes. There are type 1 and type 2 diabetes. Type 1 is when the body's immune system destroys the cells that release insulin, eventually eliminating insulin production from the body. Without insulin, cells cannot absorb sugar or glucose, which they need to produce energy. And in type 2 can develop at any age. It is commonly becomes apparent during adulthood, but type 2 diabetes in children is rising. The type 2 diabetes accounts for the vast majority of people who have type 2 diabetes, 90 to 95 out of 100 people. In type 2 diabetes, the body isn't able to use insulin the right way. This is called insulin resistance. As type 2 diabetes gets worse, the pancreas may make less and less insulin. This is called insulin deficiency.
What do people feel? Ask a diabetes person. Well, diabetic person. Some people interviewed a person with type 1 diabetes. She said this: at the teenage years, she started hiding her diabetes. She would often ignore it, and once she almost died as she ignored it around graduation. She was revived later. She takes around 10 injections a day for her diabetes. When she has high blood sugar, she can often feel it and says she's sleepy, really thirsty, and says her brain likes coffee, feels like toffee. She barely has snacks between meals and never drinks soda. This is pretty healthy person and has
had eat ton of fruits and vegetables.
And drinks lots of water. She says the worst thing about having diabetes is having a roller coaster of emotions. Both types of diabetes can often affect anyone who has them.
And then, what are the causes of diabetes? Type 1. In type 1, diabetes is caused by the immune system destroying the cells in the pancreas that make insulin. This causes diabetes by leaving the body without enough insulin to function normally. Type 2. When you have type 2 diabetes, your body, fat, liver, and muscle cells do not respond correctly to insulin. This is called insulin resistance. The type 2 diabetes usually develops slowly over time. Some people with this disease are overweight or obese when they are diagnosed, but
Symptoms of diabetes. Signs and symptoms can include the following: unusual thirst, frequent urination, weight change, gain or loss, extreme fatigue or lack of energy, blurred vision, frequent or recurring infections, cuts and bruises that are slow to heal, tingling or numbness in the hands or feet, trouble getting or maintaining an erection.
And then the treatments. Controlling blood sugar, glucose levels is the major goal of diabetes treatment. In order to prevent complications of the disease, type 1 diabetes is managed with insulin as well as dietary changes and exercise. Type 2 may be managed with non-insulin medications, insulin, weight reduction, or dietary changes.
Diabetes, prognosis, diabetes, and lifespan. Type 2 diabetes typically shown up in later life, although the incidence of younger people is increasing. The disease, which is characterized by high blood glucose, sugar, or hypoglycemia, usually results from a combination of unhealthy lifestyle habits, obesity, and genes.
And then type 1 diabetes usually happens at birth. It is not because of unhealthy lifestyles and choices. However, there is a good news. People with type 1 diabetes have known to live for as long as well over 85 years with the condition.
Stereotypes of diabetes. People with type 2 diabetes are fat. False. Yes, almost 90% of with type 2 diabetes are overweight, but skinny people can have it too. Fat on the stomach can easily give you it and doesn't take a lot when you're older. It's always a risk for anyone. Can be avoided if you work out and eat regularly. All diabetic people are lazy. Nope. There are a lot of people with diabetes, and many famous athletes have it. Examples: Jay Cutler, Max Domi, and Denny McGreen.
As you can see, 86 million Americans have pre-diabetes. Nearly 30 million Americans have diabetes. $1 in $3 Medicare dollars to spend for caring for people with diabetes. $1 in $5 healthcare dollars is spent caring for people with diabetes. And then $322 billion is the diabetes and pre-diabetes cost in America per year. Today, 3,835 Americans will be diagnosed with diabetes. Today, diabetes will cause 200 Americans to undergo an amputation, 136 to enter end-stage kidney disease treatment, and 1,795 to develop severe retinopathy that can lead to vision loss and blindness. Do you want us to put a link in the email? We'll put a link in the email to the video.
Diabetic myths. All diabetics are fat.
It's a myth, though, so it's not true.
People with diabetes got diabetes because they ate too much sugar. Well, no.
Yeah, they're myths, though. So
People with diabetes cannot do many jobs.
It's honestly false.
People with diabetes can't eat sugar.
They're all false. They're myths. And then acute and chronic illnesses. Acute conditions are severe and sudden in onset. They could describe anything from a broken bone to an asthma attack. A chronic condition, by contrast, is a long-developing syndrome such as osteoporosis or asthma.
How people affected by diabetes are same and different from others. People are different and the same from others because they can mostly play the same sports and be like everyone else, but they have to watch their blood sugar. They are different though because they always have to watch their food intake and obviously sugar intake.
And then disabilities with diabetes. Some disabilities that people can get with diabetes are losing limbs. If you have diabetes and you have a foot and you have an infection with your foot or any blood clots or problems, they may have to take your foot and giving you a disability.
There is Diabetes Canada, which support groups for diabetes. There is Diabetes Canada that will help Canadians with diabetes. They can get help from people with diabetes by self-management and sharing experiences, managing stress and diabetes burnout, making lifestyle changes to diet and physically activities, preventing and managing complications.
And then challenges in the community. For type 1 diabetes, there's really no challenges, but you can get bullied. Type 2 is tough though, because you'll be known as mean names and probably be talked behind your back a lot. If you try and work hard to get rid of type 2 diabetes, or try and avoid, then people won't judge you and be proud of your efforts. It's hard. So many people have it these days. There's not a lot of challenges.
Needs of individuals and families. When you have diabetes, everyone should know what to do so that you can because you can go into diabetic shock, and your family and friends should know what to do. A young boy's family, when you're older, should always carry your diabetic kit.
And then community support. There are a bunch of health services in the community that will help people with diabetes. Services like the hospital and Heartland Health will help people infected with type 1 and type 2 diabetes. And that's the end.
Thanks for watching.